merchandising. And to do so, you can log on to the official website of the university, www.ignou.ac.in.
Hello and a very warm welcome to all the viewers of Gyan Darshan channel and the learners of postgraduate diploma in pharmaceutical sales management program, that is in short called PGDPSM. I am Dr. Rachna Agarwal, Associate Professor in School of Vocational Education and Training and also the program coordinator for this program PGDPSM. So today our session is on a respiratory system. What is the structure, what is the function, how it functions, and what are the various kinds of disorders of the respiratory system. This particular topic is given in one of the chapters of your course MVE001, which is the first course on Introduction to Anatomy, Physiology and Pharmaceutical Chemistry. So let us begin and see what all our respiratory system comprises of. To begin with, let us see what are the objectives of today's session. First of all, we will cover the components of the respiratory system, and we will also see how what is the structure of the respiratory system, how it functions, and what are the various processes involved in respiration. And lastly, we are going to also see what are the commonly occurring pulmonary function disorders. So, as we all know that respiratory system in human, the main organs which are responsible for breathing are present in the thoracic cavity. That is, thoracic cavity which is formed by the rib cage and a dome-shaped tissue that is called the diaphragm. And inside this rib cage are the pleural membranes. Now these membranes are enclosing the pair of lungs in the chest cavity, and as we all know that our human body consists of two lungs, that is one on the right and other on the left side of the chest. Now respiratory system is also known as the pulmonary system, and we have various stages in which the respiration follows. Now to begin with, first of all, the respiratory system comprises of nostrils. We all know that either we are breathing through nose or we breathe through mouth. So both these culminate into a region which is called as pharynx, where you know we have pharyngeal membranes, where we have sinuses. So that area is called the pharynx. And then we have the larynx, which is the voice box, followed by trachea, which is a windpipe or a tubular structure. And from there are two bronchi which enter into each of the lungs. Now starting from the trachea, you can see here in this diagram, as I have explained, here nostril, sinuses, then this goes into larynx, pharynx. First is the pharynx where all the sinuses are located, then the larynx which is the voice box, then we have the trachea, this tube-like structure, and it divides into two bronchi which enter into each of the lungs. So each lung also comprises, if we go at the molecular level, in the microscopic structure, we will find that each lung is composed of wick. Now each of this lung, it floats into the thoracic cavity and it is surrounded by a thin layer of pleural fluid. This fluid helps in the movement of the lungs. That is, it lubricates the lungs from the outside so that the lungs can easily slide into the pleural cavity. So it helps in movement of the lungs and also in compression and relaxation of the lungs when we breathe in and breathe out. Now both these lungs are connected to a tubular bronchi, which, as we have seen, which is coming from a trachea, which is a single pipe. Now just imagine we have an inverted tree. Inverted, that is upside down, and the tree has a single trunk which is dividing into various branches. Basically into two branches first, which has the two bronchi. No, it is a tubular pipe-like structure, and this pipe-like structure is protected by C-shaped rings of cartilage. And these C-shaped rings of cartilage prevent it from collapsing. So the trachea leads into the pharynx, and further it is connected to the nostrils on the upper side, and on the lower side it is connected into the two bronchi. It divides into two bronchi and connected with enters into the lungs. Now if we see, both our lungs have a different structure, in the sense, slightly different structure, not much. The right lung is divided into three lobes, that is the superior lobe, the middle lobe and the inferior lobe, while the left lung is divided into only two lobes, that is the left, superior and inferior. And within the lungs there are bronchi, that is, which divide repeatedly into smaller tubes, which are known as bronchioles, and which further divide into smaller and smaller fine tubules, which are known as terminal bronchioles, which form a network of tubes. Now each terminal bronchiole, that is the finest of the tubes, it ends up having a alveolar duct. Now what is this duct? This alveolar duct is a grape-like structure, or you can say it is comprising of alveolar sacs. Now each bronchiole terminates into an alveolar sac which looks like a bunch of grapes, which is nothing but alveoli. You can see here what I have explained. This is a trachea which is surrounded by C-shaped cartilaginous rings here, and it is dividing into two bronchi, each bronchi entering into the lung. Lung was given here, but inside the lung, this bronchi divides several times, 1, 2, and then finer tubes, tubules and all. And you can see here now it is culminating into very fine tubes, which are the bronchioles, and here you can see some nodule kind of things coming up. So this is the stage which is the finest of all, very fine tubes, called the respiratory bronchioles, and these are after the terminal bronchioles. Now if you see here, the respiratory bronchioles, they have alveolar ducts. These are grape-like bunches. Okay, so each alveolar sac is comprising of various small alveoli which are microscopic in nature, but they resemble like a grape. And each alveoli is the finest, it's the final structure in the respiratory system where the exchange of gases takes place. Now what is it is mainly to oxygenate our organs, the body parts, and this oxygen and to help in the exchange of gases by taking the carbon dioxide out and oxygenating the various parts of the body. Now blood is the only source or the medium which helps in carrying these oxygen molecules into the organs from the lungs and taking out the carbon dioxide from the body parts or organs back to the lungs for expiring. respiratory system supplies the body with the required oxygen and eliminates carbon dioxide, as I've told, from the blood, thereby keeping the body organs healthy and alive. Now, if we see the process of respiration, as we breathe in, the air or the oxygen molecules enter the nostrils and travel downwards from the pharynx and trachea to finally reach the bronchi. Now, from each bronchus, the air travels into the lungs, then to the bronchioles, and then reaches the alveolar sacs. And alveolar sac consists of bunches of alveoli, as I have explained, which are the final units where the exchange of air takes place. Each alveoli has very high surface area. You see, each alveoli is surrounded by a network of capillaries, that is the finer capillaries. Now, why I'm using the word capillaries here is because they are carrying blood. Okay, so when we talk of the tubes or the tubules, we use the word the bronchioles, the terminal bronchioles, and these are the finest tubes which are in the lungs. But when we are talking about the capillary, the blood, and which help in exchanging the oxygen and carbon dioxide molecules from the lung, that is the alveolar structure, into the blood and then to the various parts of the body. So the oxygen molecules travel from alveoli into the RBCs, which are present in the blood capillaries, and thus the exchange of gases takes place between the alveoli and the blood capillaries, and oxygen molecules are given in and carbon dioxide is removed during expiration. Here you can see this particular structure wherein a finer diagram of alveoli is given, and this alveoli is surrounded by, as I said, network of capillaries. These are all networked capillaries which are carrying oxygenated or deoxygenated blood in them, and this is the hollow structure. Each hollow structure, as I said, is alveoli has a very high surface area. So this is a transfer section of the alveoli in which you can see here the gases are present, and from this is the finest part of the lung, that is the respiratory system, and from here the gases diffuse to the capillaries which are filled with blood. So then it goes into the circulatory system. So this cycle is repeated when we are breathing in and breathing out. So this is the final structure within the lungs which is responsible for your respiration. So each lung consists of millions and trillions of such alveoli. And the filling and emptying of the air, it keeps on happening, and the lungs keep getting inflated and deflated because they are like a balloon. Whenever the lungs are inflated, the air is filled into it, and when it is deflated, when the expiration takes place, then it collapses. So it is very balloony structure. It is very spongy structure, and what makes it spongy is the presence of lots of these bunches of alveolar sacs, which make it very spongy. Now, during the process of respiration, the external and the internal intercostal muscles also play a big role. Like in the rib cage, in between the ribs, there are muscles. So whenever the chest, whenever we inspire the air, the chest expands, and these muscles help in expansion of the chest. So between these ribs are the intercostal muscles, which also play a big role. I have explained the diaphragm is there, which is like a dome-shaped cartilaginous structure which moves up and down, and when we expire, the diaphragm moves up so that the lungs can contract, and when we inspire, when we take in the air, the lungs inflate, so the diaphragm moves down. So these are all the surrounding structures within the rib cage which help in the process of respiration. Now, diaphragm, we have seen the use of diaphragm. So how much air do you think we breathe? Now, this is a little interesting, that when we are in a resting mode, that is when a normal human is breathing in a resting mode, he or she breathes about 12 to 20 times per minute. And in every breath, 500 ml of air per breath is exchanged. That is about 6 to 8 liters of air per minute is inhaled and exhaled. you must be knowing that it is advised that we should drink 2 to 4 liters of water per day. Per day. But here, how much of air are we taking? Every minute we are taking in 6 to 8 liters of air. Every minute. So you understand that it is how important it is to have a fresh and healthy air to be supplied to our body, so that all our body organs are kept fresh and kept healthy and oxygenated. Because as the levels of oxygen in the body drop, many problems start arising. Especially when we are lethargic, we should go out and take a walk in the fresh air or garden or something, so that the statistics of air, how much we are breathing in and how much of oxygen is entering, it is about 250 ml. Out of the air, the component of the oxygen is limited, so 250 ml of oxygen enters the body per minute and 200 ml of carbon dioxide is given out. So the amount of air that moves into the lungs with each inspiration is called the tidal volume. So what is tidal volume of the lung? That is the maximum amount of air that can be expired after deepest inhalation, and it is known as the vital capacity of the lungs. So if you have to see that how much is healthy your lungs are, we measure it in terms of the vital capacity of the lungs. And we know that the measurement of vital capacity will show that how much air your lungs can accommodate, and whether any part of the lungs is unhealthy, or it is not responsive, or it is not functioning well. So if that happens, if there is a disease, if there is some lobe which is not functioning properly, then your vital capacity goes down. So normally in women, vital capacity is about 3 to 4 liters, and in men it is about 4 to 6 liters. So one which is very interesting thing is here is that how much so ever air we breathe in, our lungs can accommodate maximum 6 to 8 liters. But if somebody is having lesser lung capacity, then maybe it is around 4 liters of capacity of the lungs. But you would be surprised to know that at any time, how much so hard you expire, you try to breathe out each and every molecule of air which is there in your lungs, but at no point of time can the lungs be totally empty. The lungs will always retain some air within them, and that is the reason the lungs do not collapse. So the amount of air which is left into the lungs when the entire air is expired out, when the complete lungs are made emptied, that amount of air is known as residual volume. So now we know 2-3 things. That is, one is the vital capacity of the lungs. Vital capacity is the maximum amount of air that the lungs can accommodate. Residual volume is the small amount of air which is left even when when we expire everything out, most of the air is expired out, still little bit of air is left so that the lungs do not collapse. So that is known as the residual volume. Then we have also here seen what is the tidal volume. Tidal volume is the amount of air that is exchanged after during the inhalation process, that is taking in and taking out. Now some amount of air is always left behind, as we have seen, as I have already explained, the respiratory system. Now let us quickly see that what are the various kinds of disorders or impairments of the respiratory system. There are 2 main types of pulmonary function disorders or impairments, as we say. They are obstructive and restrictive. Now obstructive impairment is one which occurs due to the narrowing or closing of the small tubes or tubules or the airways, so that the flow of air is affected. That is, it makes it difficult to exhale or expire the air. Now, in present times, obstructive diseases are more commonly seen as they arise from exposure to pollutants or allergens. So, we know that there are 2 kinds of pulmonary disorders. One is obstructive in nature and other is restrictive in nature. Obstructive happens when the lumen of the airways is narrowed. It is blocked. So the free flow of air is affected. So this is called obstructive disease. And this obstructive diseases, you must have heard of COPD, chronic obstructive pulmonary disease, and other diseases wherein the lumen of the airways is narrowed. Okay, so these such diseases are more common in smokers also. Smoking is one habit which, like we know that any heart attack or any heart condition happens because when the blood vessels become plagued with the fat or cholesterol, as we know, lipid deposits. Similarly, any chronic obstructive pulmonary disease happens when these small tubules or the airways, they become blocked. Their lumen reduces, and once the lumen or the passage of air, when it becomes smaller and smaller, the airflow gets affected, and once the airflow gets affected, then we say that person has to make more effort to breathe in and breathe out. So the more effort you have to make, so we say this condition of the lungs or the airways is known as obstruction disease. So we call it obstructive disease. And it also can happen because of certain dust pollution, allergens, besides the smoke, and obviously biomass burning. So in obstructive diseases, lung volume usually remains unaffected, but the airflow gets reduced due to inflammation, swelling, or spasm of the walls of the airways. And in the second kind of pulmonary function disorder, that is in restrictive impairment, the overall lung volume is decreased and there is a decrease in the total lung capacity. So you understand, in one, the flow is reduced, and in the other, the total overall lung volume is reduced. Now we will see when obstruction takes place in the upper airways. That is, as you have seen in the earlier diagram, that from the trachea, the bronchus was dividing into various smaller tubules. So each branch of the bronchi is called as one generation. Now there are various kinds of generations, various number of generations. We can say up till maybe 16 or 17 or 18. If in the first 9 generations of the branching of the tubes, that is when the diameter of the airways is still more than 22 millimeters in diameter, we say that these structures comprise of the upper airways. And when obstruction takes place, so when the obstruction takes place, it is the upper airways obstruction, and you can imagine that the smaller tubules are further down, further smaller in size, further reduced. But the upper ones, we see that they are still larger, and they are maybe around or greater than 2 millimeters in diameter. So in chain smokers, these upper airways become narrowed. So forget about the lower ones; they are already damaged. But even the upper ones, they get blocked or obstructed. And the lower or the smaller airways obstruction occurs in the airways beyond the 9th generation, and this again is attributed to smoking, air pollution, and respiratory tract infection. So it is a bottom-up approach, in the sense first the smaller ones get clogged, blocked, and then gradually and slowly it leads to the upper blockages. So once the smaller ones get blocked, obviously the breathing is impaired, and it reaches to the extent that even the upper airways get blocked. So there we say it is the upper or accordingly we classify it into upper or lower airways obstruction. Now one very interesting thing is that you must have heard of particulate matter or the suspended particulate matter, which is called as respirable suspended particulate matter, and it is usually less than 10 microns in size and diameter. So very fine particles of dust or any other pollens or any smoke particles which are less than 10 microns in size, they have the capability of entering deep into the airways, deep into the lungs. And particles which are larger than 10 microns in size, they are filtered by the hair which is present in the nostrils, and they are also trapped by the mucous membrane which is lining our nostrils and our pharynx region. So any particle which is more than 10 microns in diameter cannot enter the lung because it is trapped and filtered at the level of the nostrils, and any particle which is lesser than that size, or maybe finer particles which we say, respirable particles which we say, it has the capability of doing much more damage to the lungs, as it can penetrate deep into the lung to up to the smaller airways. So particles less than 10 microns in size, they are the most dangerous, and they can cause bronchial constriction as well as coughing, which we say that, oh, we are having cough, we are having a lot of cough, which is something is blocking but it is not able to come out. Why? Because once the airways get blocked, it becomes very difficult for those particles to come out unless and until we aid them with either the medication or things like steam or other treatments. Now, some of the commonly occurring function disorders, pulmonary function disorders which are arising from impairments are bronchoconstriction, that is the constriction of the airways due to contraction of involuntary muscles in the walls; bronchiolitis, that is narrowing of the airway lumen due to inflammation of the bronchial walls, and it results in decreased airflow. Here you can see in this diagram, it becomes to this much. Why? Because the muscles of the walls here have swelled up. They have become allergic. Maybe this is an allergic reaction, or maybe they have become clogged. So such impairment is called bronchoconstriction. Similarly, here you can see in bronchiolitis, this is the inflammation of the walls of the airways. Chronic bronchitis, you can see here, in which a lot of cough is produced, and why it is chronic is because it is for more than 3 consecutive months that the cough is produced. And here also you can see that the lumen is filled with either mucus or it is just clogged. Then we have chronic bronchitis and other conditions like emphysema and pulmonary edema. In chronic bronchitis, the production of cough is again for more than 3 months. Emphysema, here what happens, there is a destruction of the alveolar walls. Like the alveolar walls themselves get destroyed, and so the diffusing capacity and entrapment of air in the alveoli happens. In pulmonary edema, fluid accumulation in alveoli and interstitial spaces is seen. Here you can see in this particular diagram, the walls have just been destroyed. So in emphysema, there is permanent enlargement of the airspace, and the functioning or the exchangeable surface area is reduced. But in pulmonary edema, you can see each and every alveoli gets filled with mucus. So here the expelling of the mucus is very important. Now, the 2 most commonly occurring respiratory problems which we all are familiar with is cough and asthma. So cough, we all know what is cough, we experience it every now and then. But cough as such is a reflex action. It is a protective reflex action, that something the body which is entered into the body, it is trying to expel. So cough is actually a symptom, it is not a disease. And asthma, if we see here, asthma means difficulty in breathing. Asthma can also happen because of various reasons, and we know that constriction of bronchial muscles and swelling of bronchial mucosa leads to asthma. So thank you very much, and let me just sum up here that what we have studied today is structure of the respiratory system, function, process of respiration, airway impairment, and the commonly occurring pulmonary function disorders. Thank you so much.